All right, team, listen up. We've got a patient with 3 key symptoms: osteochondritis, benign acute childhood myositis, and photophthalmia.
Based on those symptoms, I think it could be a rare autoimmune disorder affecting the muscles.
I disagree. I believe it's more likely a genetic bone disorder causing inflammation.
I'm leaning towards a condition related to the eyes, possibly affecting the patient's vision.
I think it might be an infection causing muscle pain and inflammation.
You're all wrong. It's none of those. It's ALPS, responsive beige.
Are you sure, Hawks? That's an extremely rare condition.
I'm sure. And the treatment is clear. We must perform abdominoplasty on the patient.
But that procedure is risky, Hawks. Are you sure it's the right course of action?
I don't care how risky it is. I'm the lead doctor here and I say we do it. The patient's life is in our hands.
All right, let's prep for the surgery then. We have no time to waste.
I still have my doubts, but if Hawks says it's the way to go, then let's do it.
That's what I like to hear. Now let's save this patient's life, no matter what it takes. Tracy, I need to perform abdominoplasty on my patient. I believe he has ALPS, responsive beige, like anchor protein deficiency.
Hawks, are you sure about this diagnosis? You've been wrong before.
Wrong before. That's a lie, Tracy.
I'm just concerned, Hawks. Your track record speaks for itself.
If you want to be concerned, maybe reflect on the reasons why you're on husband number 4.
That's not even true. You know that.
Oh, you're right. I forgot you went to Vegas last week and took part in one of those novelty weddings so you could live the glory days you skipped in medical school.
Damn it. This is not good. The patient is in critical condition after the abdominoplasty.
I can't believe Dr. Hawks went through with it despite knowing about the ALPS. Responsive beige like anchor protein deficiency. Abdominoplasty was definitely not the right treatment.
We need to figure out what the correct treatment should be. This is a serious situation.
I think we should start by stabilizing the patient and then consult with other specialists to find the best course of action. It's not as dire as it seems.
Not as dire. They're in critical condition, Gary.
That's what the machines are telling us. Maybe the patient is actually fine.
You incompetent fools. How could you misdiagnose ALPS, responsive beige, like anchor protein deficiency, and abdominoplasty? Are you kidding me?
Dr. Hawks, we are truly sorry for the error. What do you think the correct diagnosis is?
Yes, please tell us. We need to correct our mistake.
We will make it right. Just guide us on the correct path.
Please, we value your expertise.
What should we have done differently?
You should have done your damn job properly. I can't believe I hired such a bunch of imbeciles. The correct diagnosis is perforated viscus. You morons. And the treatment should have been immediate surgery, not some cosmetic procedure.
It was your idea.
Yes, but you performed it. Maybe fine voices, you stupid invertebrates. I can't believe how long it's taking to crack this case. It's like chasing a ghost in the dark.
Well, that's the nature of medicine sometimes. Patience is key, my friend. How are your patients faring?
Honestly, I haven't had much time to check up on them. My mind has been preoccupied with this one puzzling case.
I see. The oncology department has been quite busy lately. But hey, you'll figure it out eventually. You always do.
Wait a minute. So I think I've got it.
Got what?
The missing piece to my patient's diagnosis. I have to go check on something.
Sorry, Johnson. Catch you later.
Was the missing piece the egg salad sandwich?
Yeah, I forgot to stuff it in the patient earlier. Storms and...
Hawks, what the hell are you doing? You can't just barge in here without proper gear?
Yeah, it's a sterile environment. You're compromising the patient's safety.
ignores their comments.
Hawks, you better have a good reason for this reckless behavior.
I do. I found a mistake in the diagnosis. It's not ALPS, responsive beige, like anchor protein deficiency. It's X-linked ichthyosis.
X-linked ichthyosis. What's the prognosis for that?
Well, luckily it's not life-threatening. It'll mainly affect the skin, causing dryness and scaling.
Impressive, Hawks. But next time, please follow protocol before storming in like that.
Whatever. I was wrong about the diagnosis, Tracy. It was X-linked ichthyosis, not ELPS. Responsive beige, like anchor protein deficiency.
Well done, Hawks. It can be difficult to admit when we're wrong. The important thing is the patient has the correct diagnosis now.
Well, I wasn't wrong. My doctors are idiots and failed to warn me it was not a good idea.
Hold on, Hawks. You were the one who made the initial incorrect diagnosis.
I mean, should have caught that error sooner. They need to be more thorough in their assessments.
You need to take responsibility for your own actions, Hawks. Blaming others won't solve anything.
I blame you for wasting my time. There's a delicious chicken, Parmesan, waiting for me at home, getting colder by the second.
The one in your freezer?
Fuck off.